It felt like someone was sticking a knife in my back and slowly pulling it out.
Her fingers would get fixed and tight and like mangled.
He was shedding his skin, I would say, something like a snake.
He didn't look like my son anymore. It just scared us to death.
How could one person have all these different things wrong with them?
Would you know what to make of it if somebody came in with all those symptoms?
Next, 3 medical mysteries that defy the experts. One day, Nicky O'Donnell is a healthy 5-year-old. The next, his body is under attack from a host of terrifying symptoms. And no one can tell his parents why.
The anguish of watching your child deteriorate before your eyes, it's incredible.
Then, Christine Lupinacci is a supermom until years of relentless, debilitating pain leave her questioning her own sanity.
Been on medication for years and I'm still in excruciating pain. Maybe something's wrong with my head.
And Jackie Spar is an outgoing teenager who's full of promise until her own body begins to betray her.
The pain was so severe that we should just say to cut off her legs.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In 2000, Uma and Vincent O'Donnell's son Nicky is a healthy, happy 5-year-old child.
He liked to go to the park, play ball with his daddy, help mommy cook. Just a happy little boy.
Nicky was a playful little guy, always in a good mood, always wanting to just have fun.
He was never really sick in his life. He was a very healthy boy.
But on April 13th of that year, everything changes.
So it was around 8 in the evening, and I just ordered Chinese food for the children. And Nicky came up to me and said, "Mom, I don't feel well." I took his temperature. He had a temperature of 103. And when I closely examined his body, his ankles were swollen, and he had a rash around his ankles.
It was all over his body. They looked like nickels, and they were red and raised.
I thought it was an allergic reaction to the Chinese food, and I immediately called his doctor. And he said to give him an antihistamine and also pain medication. I gave him his medication, and I figured he was going to be fine.
But when Nicky wakes up the next morning, he's not fine.
Usually, he would be the first one up in the morning, jumping out of bed and getting the rest of us up. But this morning, he just laid there. First thing to do is we checked his temperature, and he was still running a very high fever. His temperature was 103 at that time, and he was shivering.
Everything was there, the swelling, the rash, the fever, and he was complaining of stomach pain.
Concerned, Uma and Vincent take Nicky to see the pediatrician.
The doctor stated, it looks like just a common virus, nothing to be too worried about. 2 or 3 days, he should be fine.
But by the next morning, Nicky isn't any better. In fact, he's worse.
It's April 15th, and his symptoms are still persistent. He's still swollen, the rash is still there.
I remember this big bloody scream. He woke up and he said his belly was hurting, and after that he started throwing up.
He was in a fetal position, moaning, "Mommy, help me." I put him in the bathtub to bring the fever down because it was like 103. It was climbing, actually.
Now Uma and Vincent are getting worried. They take Nicky back to his pediatrician, who gives him a strep test, but it comes out negative.
Doctor said, "Take him home, he's fine. It's a virus. It's gonna be over soon, it has to run its course."
With that, we took him back home, thinking maybe he does just have a bad flu.
Vincent and Uma give Nicky more pain relievers and put him to bed, hoping his strange symptoms will subside overnight.
On April 16th, all hell breaks loose in the house. My son's temperature climbs. It actually goes above 104 temperature. And he's very lethargic. He wouldn't even move. His eyes are just rolling in the back of his head.
Nicky's eyes were bloodshot red, and they were like fire, flames of red. And his tongue was very red and glossy, like a strawberry.
He didn't look like my son anymore. The bloodshot eyes and the strawberry tongue and the swelling and the persistent fever. It just scared us to death. I've never seen anything like this in my whole life.
This time, Vincent rushes Nicky to the hospital, hoping a new doctor may have a new take on Nicky's mysterious illness.
And they said the same thing as the other doctors said. None can be done. And there's no medicine. It's a virus and it'll run its course.
Not knowing what else to do, Vincent brings Nikki back home once again.
He says to me, Nikki is fine. The doctor said he's fine, he's gonna be fine. And I said, he's not fine, he's dying.
I said, I'm not a doctor. We're not doctors. They're doctors. I didn't go to medical school, they did.
And I said to him, I am his mother. I'm his first doctor. And I knew something was wrong with my baby.
The next morning is April 17th, 5 days since Nikki first fell ill. His parents hope the frightening symptoms have lessened overnight, but what they find instead is horrifying.
The skin was starting to peel on his fingers and the bottom of his feet. Sort of like when you have a sunburn.
It looked like dried glue. After you have it and it dries off on your fingers, and it's all like peeling and crusted.
And I feel his heart, and his heart is pounding out of his chest.
Uma is now out of her mind with worry. She rushes Nikki back to his pediatrician yet again.
I pleaded to the doctor, let's get him hospitalized. His brain is frying. He's dying. No, he is not dying. He has a virus. He's going to get over it. No one would listen. It was like hitting a brick wall. And I guess they looked upon us like real hysterical parents.
My wife said, if something happens to my child, you're going to be held accountable.
If he dies, it's on your head. It's your responsibility. And I want him to be hospitalized. And as adamant as I was, it went nowhere.
Uma and Nikki leave the doctor's office without treatment or answers. They go home and wait.
We all knew that it was no flu or virus. He was dying on us, and no one could stop it.
The anguish of watching your child deteriorate before your eyes, it's incredible. It's a feeling that no mother or father should ever go through.
It's a helpless feeling. You feel like you're failing.
April 20th. 7 days have passed since Nikki first fell ill, and his symptoms aren't letting up.
My wife kept saying, go back, go back. So I took Nick to the pediatrician. The doctor looked at him and said he might have scarlet fever.
Scarlet fever is a bacterial infection that most often strikes children. It's named for the scarlet rash it produces all over the patient. Vincent rushes Nikki to the hospital, where he's admitted right away and given a series of blood tests.
And then the following morning, our pediatrician that we had came in, said, his tests all came back fine, I'm going to discharge him. And with that, my wife said, this boy's still sick, he still has a fever. How can you discharge him?
I just felt he was wrong. He was dead wrong. And then he proceeded to show us the labs. Look, his labs are fine. I'm gonna, discharge him. And I just told him, he is dying. You are not discharging him. In fact, it's over. You're off this case.
My wife says, you're fired.
And I pointed and I said, you are never to come next to my son again.
His jaw dropped, and my wife said, now leave this room right now. He just walked away, and there we were.
And my husband held his head. He was like, oh my God. Because at that point, we didn't have a doctor. We didn't have a prayer.
Just 7 days ago, Nicky O'Donnell was a perfectly healthy 5-year-old, but now he's in the hospital fighting for his life. What seemed like a virus has turned into something much more terrifying, and no one can tell the O'Donnells what it is.
My wife started asking around. She asked one nurse, do you know any doctors who I could call to help my son? She said, oh, I know good practice, MD for Kids.
Uma immediately calls MDs for Kids, a private pediatric practice. In a matter of hours, Dr. William Gerba appears in Nikki's hospital room.
When parents are unhappy, they have an option of calling in another physician to assume the care and to ask the primary person to step back. Uma was desperate. She wanted someone to come in and pick up the ball. So I stepped in.
When Dr. Gerber came over, there was a calm inside of me that I knew that this was the man who's going to save my son's life.
I come into the room and Nikki is lying in bed.
Wasted no time, looked at Nick's chart. They examined him.
He was peeling or shedding his skin, I would say something like a snake. It was just scales were falling off. We have fever persisting, rash persisting, cracked lips, bright red palms.
And he turned around to me. He asked, how long has he had this fever for? I said, this is about like 8 or 9 days now he had it. He goes, we have to do something now. He has to get treatment right away before the window of opportunity is closed.
Dr. Gerba recognizes Nikki's strange symptoms from a previous case, and he knows it's no virus.
In my mind, with Nikki's symptoms and story, this was Kawasaki's disease.
Kawasaki disease is a rare disorder that affects the vascular system. For reasons unknown, the body overreacts in its response to an initial infection, resulting in inflammation of the blood vessels all over the body. If not treated in time, Kawasaki can lead to serious heart problems, including aneurysms and weakening of the coronary arteries.
There is a great sense of urgency. Treatment done before 10 days has been the most successful in preventing serious cardiac complications.
We have a 10-day window to treat this disease, and we're on the 10th day.
Dr. Gerba immediately orders an echocardiogram to see how far Nikki's Kawasaki has progressed. The results are terrifying. The blood vessels leading to Nikki's heart are dilated, and an abnormal layer of fluid is surrounding his heart.
That indicates that there was some inflammation going on.
Every hour counts. If Nikki's condition worsens, a blood clot could form, leading to a heart attack. Dr. Gerba must start treatment immediately. Kawasaki disease is treated with an intravenous infusion of protein called gamma globulin and high doses of aspirin, which reduce inflammation.
That morning they administered it. It was administered through the day, the afternoon, through the night. And then late the next morning, and his fever broke. His life came back to his face. His eyes cleared up. The redness went away, and he was back to his old self.
The relief, it was overwhelming.
But the relief is premature. Although Nikki's been treated and his Kawasaki disease most likely won't return, his 10-day struggle with the illness may have left his heart irreparably damaged.
Kawasaki disease is like a fire. Yes, we could put out the fire, and yes, the trees will grow back, but we don't really know how much damage is done.
We had to do echoes every couple months, and he was on aspirin therapy.
Fortunately, the fluid around the heart and the dilation of the coronary arteries resolved.
My son is safe. I can dance at his wedding. It was good.
He looked so much better, and I just cried for joy. And I was jumping, literally.
5 years later, Nikki is once again in great health.
I'm 10 years old now, and I'm very healthy.
He's an absolute joy. You can't ask for a better son, a better child.
And I asked him, so what do you want to do now when you get older?
I want to be a pediatrician so no other kid could suffer this disease.
Nikki and his parents are grateful that Dr. Gerba recognized the signs of Kawasaki before time ran out, but they wonder why Nikki's other doctors did not.
There is no single test that can tell a physician that this is Kawasaki syndrome. It's a pattern, a constellation, a grouping of signs that one puts together as a package. I think it's quite appropriate to assume when you see someone early in an illness that they have a virus, because that's 99% of what most children have. It's when he failed to improve that the red lights had to go on, and people had to start thinking now, uh-oh, what else could this be?
Later, I came to the realization, well, if my wife wasn't so adamant firing his doctor, there would have been very dire consequences.
You have to be your children's advocate. Mothers are the first doctors. Always trust your instinct and your gut.
When Nikki's illness struck, it was only a matter of days before he was lying in a hospital bed.